EMRD as a system provides emergency medical care of the patients. Drone, normally used for aerial photography, data collection, reconnaissance, and so on. EMRD is designed and integrated with critical medical equipment, and to be dispatched to the accident scene in short period.
Currently, some of the area are facing the delay of the emergency services due to traffic congestion. Sometimes, the dispatch of the emergency responder are delayed due to lack of ambulance service in certain hospital. Patient might suffer from cardiac arrest due to delay of medical care. Did you know? The chance of surviving a cardiac arrest will increase if the casualty is in a shockable rhythm. The EMRD is built and integrated with the several critical medical equipment, including automated external defibrillator, ECG collection module, oxygen saturation reader module, and oxygen supply module. The collected data will be sent to Command Center for Medical Officer analysis, meanwhile give the instructions to the helper through live stream video. The commercialization potential including, the device can be used by the Accident and Emergency Department, university, sports center, or school. Recreational or national park management. Highway concessionaires or highway. Any government agencies including a TM, RELA, and a PM. Here will be the fabrication and testing section we have carried out. The design of the small portable ECG circuit and testing results. Here is a design of the SpO2 circuit and the testing results. All these results will be sent to Command Center. Lastly, the design of the hexacopter drone to integrate with the critical equipment. Now, we will demonstrate you the feature of the EMRD. SpO2 and oxygen supply module.
Are you okay?
Not very well.
I call 999. Hello? I'm calling from Santa University College. We need emergency medical service here.
The arrival of the EMRD at scene.
Carry and locate the drone near to your patient. Then open the upper storage case. There is an oxygen mask and our SpO2 sensor inside. Help the patient wear the oxygen mask. Insert the sensor onto patient finger. The system will operate itself and will stop once the patient blood oxygen saturation back to nominal level.
IED module. When a person is heart attack or cardiac arrest, the chances to survive the patient is within the 4 minutes.
Hello, I'm calling from Southern University College. We need emergency medical service here.
The arrival of the EMRD at scene.
Carry and locate the drone near to your patient. Then open the upper storage case.
Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the two locations shown. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient.